So alcohol-based hand rubs, they're waterless antiseptic agents. You don't have to use water with them. They usually contain between 60 and 95% of alcohol. Now, the CDC actually contains between 60 and 95%. Quite honestly, the reason I use the Clorox product is it's dialed in at the sweet spot of 62%. When my staff and I use it up here in Michigan where the air is dry, our hands aren't all beat up. That's why we use the product. So remember, even though it says 60 to 95%, higher isn't necessarily better. Plain or non-antimicrobial soap. Soaps are detergents that don't contain antimicrobial agents. That's really what we're talking about. Antimicrobial soaps, things that contain an antiseptic agent of some type. And surgical hand scrub, an antiseptic containing preparation that substantially reduces the number of microorganisms. It's very broad spectrum, very fast acting. Again, this is something you'd use for a surgical scrub. Now, take a look here. I know most of you have read this, including in lay publications, but in September of last year, the FDA prohibiting the marketing of over-the-counter consumer hand wash products containing any one of 19 antiseptics. One of them was triclosan. The problem with triclosan is this. It's been proven that it's not any more effective, it's not any more safe, it's not any more effective than soap and water. That's why they pulled it. Now, remember, too, that although this affects consumer products, you can still buy things with triclosan in professional products. That's, again, another reason why I happen to like the Clorox products. They don't have triclosan in. I don't really want to use something that has been deemed, quote, no more effective, no more safe than soap and water. So involved team members. Long before I was involved with Clorox, we used these products because I actually had my team pick them because people are not going to use the product. They don't like the way it smells. If they don't like what it does to their hands, they're going to quit using it. So some important things to look at. Look at the ingredient list. See what's on there. Make sure it's got the right things in it, the right concentration. Consistency. A professional grade product is going to be consistent. Not always so for over-the-counter things. That's why I don't buy my soaps that I use in the office, my alcohol-based hand rubs, my disinfectants. I don't buy them at Walmart or Costco. I buy them from a reputable dealer. I use professional products. How does the skin feel after frequent use? Again, that's how I got into the Clorox alcohol-based hand rub. It didn't destroy my hands. Ability to quickly glove up, that's a key reason why I go to alcohol-based hand rubs, is I can go from patient to patient without having to spend tons of time re-drying my hands because my gloves won't go on. My problem when I wash with soap and water is it tears my gloves very carefully dry. And also make sure that the product you get has a good product dispenser that people like to use and that they will use. Because if they don't like it, guess what? All of a sudden they're relying on their gloves. They're not using the products.